the molecule which we are all interested to talk about was curcumin. Curcumin, when I went and searched, it was leading to turmeric, and this is a natural extract. So how we are all acquainted with the turmeric, I think in Andhra Pradesh, we are all with pulihara, I feel. This is the dish which is we are all more familiar with turmeric. And today suddenly this turmeric is coming to the other thing which is more famous. With turmeric from our childhood is I think this is the childhood, every one of us are very much known to this.
We got turmeric, Maggi cosmetic, we got turmeric Ayurvedic cream.
With all the permission of the Cartilage, I thought these are the things which we know about, but when you go through and there are so many extraordinary uses with the turmeric. Most famous with all ladies is the face pack. It prevents skin damage. It's an exfoliating agent for all the scrubbings, tightening of the skin, gives you a glowing skin, lightens facial hair, reduces cholesterol. So when you see a lot of controls blood pressure, there are about 15 main functions which till date we are not concentrated. But today we are concentrating. One of the very important thing is the prevention of inflammation. Out of these 15 things, today we concentrate on the prevention that prevents inflammation. So osteoarthritis is nothing but a inflammation of the joint. So how this molecule helps in controlling the inflammation of the joints. So approximately 50% of people more than 70 years are suffering with osteoarthritis. I think this is one disease which is treated by general physicians, general practitioners, gynecologists, neurophysicians, orthopedic surgeons. I think everybody treats arthritis. So it's such a common disease after cold, cough and cold, it's joint pains. 80% of the patients with OA have some degree of limitation of movement. So above 50 years, women are more affected than men. So you see myself being a knee surgeon, I always concentrate on the knees. I forgot the habit of looking into face and started looking at the knees. So when you see the knees, these are the three types of classical representation of knees. Maybe the center one is more common, but with our famous N.T. Ramarao on the right side and other things on the left. So sometimes you have varus and valgus knees which are common. But what today I am talking is prevention and inflammation at the joint level is protection of our cartilage. Such a glistening cartilage, if it gets inflammation, slowly it deteriorates. So what are the risk factors for the primary ONE? I think there are 100 causes you can see for osteoarthritis. So there are some modifiable things like excessive body mass, physical activity, joint injuries, occupation. These things are modifiable, and some things are which are really very difficult to modify, like gender. Females are more at risk, and age. You may have some localized osteoarthritis or generalized osteoarthritis. You can look into various causes of secondary ONEs. So there are textbook definitions, but the final thing is inflammation of joint is osteoarthritis. So what happens when there is a load? You can see the cartilage plays a very important role as a shock absorber, and once you lose the shock absorber, I think slowly you go into painful situations. So what is the cycle? Dr. Ravisharma has shown the inflammatory cycles in the cardiovascular diseases. If you come to the cycle in the cartilage, almost the same thing, and we are concentrating on the same molecule, that is nuclear factor kappa B, which is causing the triggering factor. When you switch on, there is This one is causing the inflammatory cascade. If you see into the normal cartilage hemostasis, there are some destroyers, there are some builders. So once the destruction is more than building, I think that leads to osteoarthritis. So the main purpose is you prevent the triggering of interleukin 1. If you can prevent the triggering of interleukin 1 for whatever the cycle you are following, that is where you can stop inflammation. This curcumin is at this point which is acting, it is prevented the activation of interleukins. So if you can prevent the interleukin activation, the destruction of the cartilage is definitely brought down, or sometimes you can delay the destruction of the cartilage. You can see the various stages of cartilage damage. You can go through all these are the various stages of cartilage damages. You can see grade 1 to grade 4. This is a doubtful grade 1 to mild, moderate, and this is the severe where there is no cartilage at all. And this is a very bad knee with loss of cartilages and lot of osteophytes. So to prevent going into such a things, I think prevention of inflammation plays a very important role. So what is causing this pain in this patient? So if you, I know this is a general topic, most of the audience are general physicians, but when you know somebody asks why there is pain in osteoarthritis, it's a lot of causes. It can be coming from subchondral bones, a synovium, or from osteophytes, capsule, tendon, and muscles. So when I open the joint, I see the cartilage destruction is in a different pattern for different people. Different ages have different people. When we see what sort of pain medications they are using, people use different sorts of pain medications, and you can see the inflammation of the synovium also causing the destruction of joint. This is a classical case where you see the inflammation of synovium. In rheumatoid arthritis, you can see there will be destruction of cartilage. A single area of destruction of cartilage you can see on the particular joint, and these are the examples where your cartilage is totally gone and subchondral bone is exposed. In this patient, every step there is pain. So there are night pains and there difficulty for the people to. So this is a very unique case where you have some osteophytes inside the joint. This is the ultimate stage for any osteoarthritis. These are the osteophytes which you have taken out from the joints. So treatment of this osteoarthritis is multidisciplinary. You can see it's not only by an orthopedic surgeon, or it includes patient education, prevention measures, medications, physical therapy, alternative medicines, injections, surgical procedures, and psychological counseling, because every patient with osteoarthritis requires a different type of treatment. I feel non-pharmacological also, we need to try treating the patients before directly going into tablets. Physiotherapy is the best option. I always say, in the young patients with starting knee joints pains, I think we should go with physiotherapy. And changing the lifestyle modifications, like these are the simple changes in modifications from Indian toilets to Western toilets, from changing their sitting habits, using the broomsticks to a long handle. These are the very small things which can make a lot of difference in the life of the patients. So when you come to the pharmacological management, today we are talking about a molecule like curcumin, but before going to that, why should we go to such a curcumin? Or why should we go to the product which has got a lesser side effects? If you can see the impact of chronic pain in the United States, 75 million people have a chronic pain and 66 million suffer from arthritis. You can imagine the burden on the healthcare system. 20 million affected by osteoarthritis and 2 million are affected by rheumatoid arthritis. So such is a big load in United States. You can imagine a country like India, I think we'll have a 5 to 10-fold increase in the patients. What are the guidelines in the management? So there are a lot of options like acetaminophen, like paracetamols, non-steroidal anti-inflammatory drugs, and you have got selective COX inhibitors, and some without selection you can have NSAIDs. There are wide varieties of options. So what is the WHO 3-step ladder in the management of pain? If you see, when you have mild pain, you can go with paracetamols and NSAIDs. The moderate pain, I think you can go with weak opioids plus non-opioids plus adjuvants. If it is severe pain, we can go accordingly. So if you see, this is a classical picture which is seen in all the departments, whether we are to block selectively COX or it is blocking COX-1 and COX-2 together. So if you block COX-1, it has got all the effects like endothelial integrity damage, vascular patency damage, gastric mucosal integrity, bronchodilation, renal functions, these are all affected. But classically, if you block COX-2, I think you can be blocking the NSAIDs. So COX-2 to COX-1 selectivity ratio, if you take, so ectrocoxib stands at one end and paraxicam stands at the other end, you got a lot of series of drugs you can see there. So lot of side effects. With all these side effects, you can see most prevalent to least prevalent, like stomach, gastrointestinal, abnormal kidney and liver functions, liver injury, failures, and very rarely recent concerns due to an apparent higher incidence of cardiovascular adverse effects. The newer NSAIDs, the COXIBs, pose some questions about this, the cardiovascular safety profile of this whole class of these medicines. So, you got tramadol, which is giving less side effects, tramadol plus paracetamol combination. You got ibuprofen side effects. If you use tramadol as a single drug, paracetamol as a single drug, and a combination of two, I think the combination of two gives a better result than going with a single. So these are all the options which we have till yesterday. Till yesterday, we have seen such a powerful people like Modi and Amit Shah were ruling this country. But suddenly, we never thought the old generation will come back. But you see today, I think this combination has come back. So in that way, the turmeric is back with curcumin. If you use this turmeric, which is an old medicine, which we know, but coming back with a full force. So what are the advantages it has got is it's an anti-inflammatory, it's an antioxidant, anti-prophylactic, and anti-angiogenic. So we have seen this switch on and off mechanism, curcumin NF-kB inhibitor. I will not go into details of this. Curcumin is effective and safe in patients with rheumatoid arthritis, that is for sure. Curcumin is found effective and well tolerated. And these are all the pilot projects which have been done, and curcumin relieves pain and reduces need for NSAIDs. If you can reduce the need for NSAIDs, I think that's solving a lot of side effects which the patient is going through. And curcumin is an effective as NSAIDs, but has better GI tolerance. If you get some painkiller with better GI tolerance, I think there's always scope for the orthopedic surgeons to think about the curcumin. And the other studies you can see, most of the studies have shown better effects, and in combination if you use, they have given much more better results than using as a single. And the safety profile, if you see, this is the safest, generally recognized as safe by US FDA approved. So this one is awaiting to be released, and the conventional, so why should we eat this tablet? Every day morning you can take a spoon of turmeric powder rather than going with this tablet. But thinking about the bioavailability, you need to take 12 grams every day to get the bioavailability. So the Cartilage has come up with the technology which converts the normal turmeric or curcumin into a easily available into the bloodstream that will give the bioavailability and enhance the actions of this curcumin. These are the bioenhanced curcumin summary. If you see, it is a suitable option for monotherapy as well as combination therapy. So, safe, well tolerated. This is the medical management of osteoarthritis. If you go through once your stage is gone after stage 2 and stage 3, I think the intra-articular injections which has been given to some patients give some amount of relief, and others like visco supplements. This is one part where there is a temporary relief for about 6 months with the usage of highly this is called visco supplements, hyaluronic acid supplements. So when you come to the surgical management, you got always arthroscopic debridement. These are the surgical points. As being a replacement surgeon, I always feel where the options medicine ends when the patient reaches grade 3. After grade 3 of osteoarthritis, if still burdening the patient with the NSAIDs or anything, it's not going to do anything. Any advantage to the patient. So go for joint replacement for patients who are in grade 3. So for all the non-orthopedic participants, this is how the joint is destroyed with osteoarthritis. Okay, this is, I go through a few parts of joint replacement. You got different sizes, shapes. Maybe it's an interesting surgery for the patients who are in grade 3 and grade 4. You got different options. You got different sizes and shapes, and this is how the joint looks after the total knee replacement. You need to make cuts. This is the bone cement what we use to fix the implants in the joint. So orthopedician's work is more or less like a carpentry. The person who is the best carpenter will always become a good orthopedic surgeon. So this is what I just want to show. The surgical options which are left to the patient after finishing all your medical modalities. Finally, you need to land up with joint replacement. You have a lot of options, lot of companies, lot of designs, lot of varieties, like how the Kalaniketan and Kalamandir provides with a lot of designs. The knee replacement has come up with extensive modalities of materials and designs, and you can see the world's best companies are today in India. India is becoming the hub for joint replacement with all these modalities. So at the end, I just want to say, cure anybody can do, but it's our duty to do public awareness programs. The one thing which I do in every public awareness program is reasonable and rational use of NSAIDs, which is creating more and more patients to nephrologists by renal failures. This is one slide I want to say. This is one time I asked in a crowd how many of them are using NSAIDs without prescription from doctor. This is the number of patients. Some are raising 2 hands. That means every day they are using NSAIDs, and the burden on the kidney and heart, I think you can imagine the effect which is causing on the patient. So I feel it's our duty to encourage the patients to take relatively good medicines. I feel Kurkirim is one of the very safest medicine which is going to be helpful to the patients. These are all my patients who underwent bilateral knee replacement and doing a fashion show at the age of 80. So this gives us my motto is happiness is happiness. Thank you.